Mike, 34 years here. The government says, hey, look, we did something wrong. We're setting aside allocating monies to compensate innocent parties and innocent families, victims, as we should say.
That's right.
What are some of the symptoms that individuals are seeing now, and to say, hey, look, I was at Camp Lejeune during that period, but I'm fine. And other people are like, well, I may have this or I may have that, you know. Name some of the things that individuals are some of the symptoms, the sicknesses, the illnesses that they're experiencing that qualifies them for some type of compensation.
Well, there's a full list of type of cancers, leukemia, that's bladder cancer, kidney cancer, liver cancer, melanoma, lymphoma, Parkinson's disease, breast cancer, miscarriages, birth defects, female infertility, child leukemia. The list goes on. What's important is there's a two-year statute of limitations. Right. You know, so if you think you have one of these ailments or have something even minor wrong, if you don't file within those 2 years.
Well, let's talk about that, because we just talked about a time period of 1953 to December of 1987.
Right.
That's one qualifying date, but now since the federal government has come forward and said, hey, listen, guys, if we have done wrong, as you put it, Mike, we have monies allocated to compensate parties that were exposed to this, but you have a statute of limitations, which basically means you have a window to file your claim or file your lawsuit and try to be compensated. And if you don't file in that time period, well, then you're forever barred from bringing this claim later, no matter if you qualify for all of these other qualifiers, right?
That's correct.
So what is the statute of limitations, and when did it start?
The statute of limitations started August 10th of this year.
Okay.
So we're talking August 9th of 2024. If you don't have a claim filed, you're barred from filing a claim.
Okay. And so, we just came out of hurricane. Most people having their hurricane claims resolved, and they got some people got a rude awakening to statutes and issues and that prevent them from receiving monies or collecting what is rightfully owed to them.
Right.
Situations like this, now we're rolling into another statute, August the 10th, 2022 to August the 9th, 2024. Preserve your claim, preserve your claim, preserve your claim.
That's the big thing.
Now, Mike, what happens if, we briefly mentioned this, but let's just say an individual lost their parent, but they're still living. Are they still allowed to file a claim?
Yes, you can file a claim if a spouse, a child, a parent that died from an injury that can be linked to Camp Lejeune, meeting the requirements. Please call us, and if you do meet that requirement, we'll be straightforward with you. And if you meet it, we'll definitely help you out.
Well, there's you got a lot of family members, and some of this may be raw to a lot of individuals because they lost someone that they loved, and now they're having to rehash that and reopen that wound. But it can, claims can be made on behalf of deceased individuals that passed away.
Very much. And
we're exposed to that time period and exposed to some of these conditions and this illness.
That's correct.
I think we have a couple of email questions that were presented to us over the week. My husband was at Camp Lejeune during the time period you mentioned. What documents or proof do you need connecting my husband's illnesses to the drinking water June?
The first document that I'd say they would need is their DD-214. That's showing that they were active duty service. And a lot of times your DD-214 will list what duty stations or training they obtained during that time. Also, other documentation to prove that you were on base. Orders, letters written, photographs of you while you were there. There's a lot of things that we can use to link that you were there during that time period. Then we need to identify that you were there for at least 30 days. And then your medical elements that you have to make sure that you meet one of the requirements that's on the list.